First and foremost, this study opened for accrual only about a year ago, and the first patient went on this study on the 29th of August 2018. So it's a fairly early in the process, whatever we are talking about now. We have had so far 70 plus patients in this phase 1 study. It's a typical phase 1 study that involved dose escalation and then eventually dose expansion. Patients with KRAS G12C mutation of various tumor types were included, but the focus of the presentation at the World Conference on Lung Cancer in Barcelona was on lung cancer, the 34 patients who were enrolled in the phase 1 study who had lung adenocarcinoma and KRAS G12C mutation in the tumor tissues. So the key eligibility criteria included, obviously in this situation, non-small cell lung cancer with demonstrated KRAS G12C mutation in the tumor tissues. Patients had to have at least one line of therapy, and their brain metastasis ought to have been controlled. So those are the key important eligibility criteria. And there were 4 dose levels explored, starting with 180 milligram once a day to 360 milligram once a day to 720 milligram and then 960 milligram once a day. And we enrolled typically anywhere from 2 to 6 patients in each cohort, depending on the safety and toxicity. And the important findings are, in terms of demographics, this is a typical phase 1 lung cancer population, heavily pretreated. In fact, more than 85% had greater than 2 lines of therapies, and the median pretreatment therapy numbers are like 3.5 or so, with a range of 1 to 8. And this agent was well tolerated. In fact, we saw mostly grade 1 and 2 toxicities, very few grade 3 toxicities. In fact, the only toxicities we saw of note were nausea and some vomiting, and diarrhea, all well controlled. There were no grade 4 toxicities attributable to the drug. There were no serious adverse events attributed to the drug, and there were no dose-limiting toxicities. And more importantly, nobody had to come off therapy because of drug-related side effects, and that's something important to note in this study. And of course, we have only studied a small number of patients, but the early toxicity profile looked very, very reassuring. In terms of efficacy, I would say that in the group of patients that had doses ranging from 180 milligram to 960 milligram, the overall disease control rate was 96%, and with a response rate of around 48%. But in the group of patients who got 960 milligram, pooling the group of patients from the dose escalation and the dose expansion cohort, it turned out that in the 23 evaluable patients overall, and in the group of patients who got 960 milligram dose, the overall disease control rate was 100%, with a response rates around 52% and stable disease in others. Very few patients have progressed. Again, it's a little too early, and more than around 5 patients or so have been on for 6 months or so. So it seems like the disease is well controlled, and there are nice responses that appear to be durable in the earlier looks.